Next is neural control. So when we talk about neural control, what neural control are we talking about? Which nervous system are we talking about? Central nervous system? No. Peripheral nervous system? No. We are talking about the autonomic nervous system. In the autonomic nervous system, all of you all know there are two types. We have the sympathetic nervous system and we have the parasympathetic nervous system. Okay, now what does the sympathetic nervous system do? Sympathetic nervous system all over the body, it will lead to vasoconstriction. So if it causes vasoconstriction, then what does it do? It obviously will decrease the blood flow to the liver, correct? And parasympathetic nervous system, whenever it is stimulated, there is vasodilation. So parasympathetic nervous system can lead to increase in the blood flow of the liver. Now parasympathetic system not necessarily increases the liver blood flow, but rather it maintains the liver blood flow. It does not allow it from getting decreased. Okay. Now it is seen that the sympathetic nervous system comes from thoracolumbar outflow. So to the liver, the thoracic nerves T6 to T11 will supply the sympathetic supply, and the parasympathetic nervous system or the parasympathetic supply to the liver is by the vagus nerve. What is the anesthetic implication of this? Whenever you have a patient who has a liver which is at a high chance of ischemic damage, you want to maintain the blood flow to the liver. So they say that you should try to blunt the sympathetic responses that happen during surgery, like your sympathetic response during the incision, or sympathetic response due to pulling or pushing of the peritoneum, or sympathetic response at the end of surgery. Okay, all of those things should be avoided so that the liver blood flow is maintained. And that's why we recommend that if there is an abdominal surgery that you are going to carry out, then you blunt the sympathetic response by putting in a thoracic epidural in those patients.